people are accessing and joining gradually, I suppose. And then it's going to be an information session. My name is Anthony Afalo. I have been given the responsibility to host this event, today. And I'm glad to join with members of the Redeemed Christian Church of God and other members within the community that's listening to us. It's not going to be a very formal show. It's going to be something, a little presentation from some of our medical, experts. We're talking about the vaccine availability for the treatment, or rather to address the need for it regarding COVID-19. I will momentarily, actually introduce our guest, speakers. They will be, introduced, have an opportunity to introduce themselves as well, and speak on the designated areas that they were all charged with. My name again is Anthony Afalo. I'm hosting this show. We should, begin shortly. I think our main speaker is joining us. I'm trying to monitor that, so pardon me. We promise it's going to be a good information session. But let me go on and immediately, introduce Dr. Adebayo Adeniran. Dr. Adebayo Adeniran has experience as a pharmacist, by training. He can, tell us, briefly, about himself also. He's he has community experience of over 10 years in the field of pharmacy. And Dr. Adeniran, I also gathered that you run a pharmacy outside of New Jersey. It's good to have you with us. Here you will be speaking, as discussed, regarding the different vaccines that's readily available to us. But before you go on, let me remind our viewers, all around that so far here in the United States, we have more than 30 million cases of COVID-19. That is 30 million cases in the United States. And then we've experienced more than 500,000 deaths. To be specific, about 532,000 deaths in the United States alone. In the United Kingdom, the number that I gather, we have at least 4.5 million cases in the UK alone, and 125,000, deaths. I stand corrected if the number differs. And then when we go all the way to Africa, let's specifically to Nigeria, at least the data that we have about 160,000 cases of COVID-19 diagnosed in 1 year, and then over 2,000 deaths reported. So we can all understand how important this is and why this thing needs to be taken care of. And by God's grace, there are vaccines available. I'll leave it to Dr. Adebayo Adeniran to just briefly tell us about the various vaccines for the benefits of our viewers, for them to have a good understanding of what's available and whatever pressure they might be feeling when it comes to getting the vaccination. So I will yield to you, Dr. Adeniran. Thank you again for joining us.
All right, thank you, Honorable. You've done a fantastic job, and thanks for coming to work with us. Thank you for your time. For those in the background, also, thank you to our pastors for letting us. I'm sorry, sir.
Those are all correct.
You can hear me, right?
Yes.
Okay, because I wasn't sure. Okay, good. All right, and thanks to our pastors for letting us having this platform. All right, so I would just want to start off with how we responded to be able to produce the vaccines that we have. We have currently, for emergency use in United States, 3 of those, and the federal government last year through the committee called Operations Warp Speed tried to respond emergently to the virus, coronavirus, uh, that was coming from outside the country, and it grew rather suddenly, and it's still going on, and it's wrecked sadly a lot of damage to a lot of people. And now we have over 500,000 deaths related to the COVID-19 virus. All right. Um, so with the government urging some companies did the research trials with tens of thousands, just so it's important to highlight that this was in the middle of the pandemic, and yeah, with the clinical trials being done to test the vaccine candidates that will be produced, they had people with different diseases such as diabetes, breathing problems, um, obesity, even cancer, um, as testing included in the clinical trials. And thank God. We also have to recognize the amount of work that has been done in research over a few decades, uh, some of which have been studied in other um, infections like Zika, influenza. So the technology, medical technology being used in this COVID-19 vaccine is not really in its infancy. It's not that new, but it's really for the first time en masse that will be used in a vaccine. But it's also been studied in other infections like the Zika and influenza and a few others. Um, so they were able to use prior knowledge and prior failings to speed up the manufacturing of the vaccine. And the new technology that got first company that's with Pfizer and another one Moderna, they were able to produce quickly and in large quantity the vaccines that were first the two vaccines that were first approved. So that's part of why they're considering this relatively new technology in producing the vaccines for this current um, coronavirus. Right. So I will, excuse I will then, I think I'm going first into the, excuse me. And so the current vaccines for adult populations, I think the youngest age we have is 16 years of age. Uh, but currently, clinical trials are also being done in younger people. Um, I don't know what will be done as far as what kind of modifications they may have to do to the vaccines that are currently being used in the younger population when eventually they will be approved, because the younger ones needs to have some kind of protection for us all to have a decent amount of normalcy to our daily living. All right. With that being said, so I want to mention the first vaccine from company called Pfizer. This is one of the vaccines that adopted the relatively new medical technology of using a messenger RNA. It's just designed to fool the body to think it is sick, or just to have a prior testing before the actual COVID virus has a chance to do any sort of damage to the human body. So i- in the clinical trials done, Pfizer discovered that they had a pretty high success rate actually of efficacy, um, over like 95% in severe infections. And that in the world of vaccinology, that is a pretty good results to have. And also, okay, so as far as when time of onset of efficacy, this for the Pfizer vaccine, that will be 7 days after taking the second dose. And I need to highlight that this particular one is in you're given 2 jabs. I think they're separated by 28 days. And moving on to the second one that also used relatively new technology, mRNA, messenger RNA. That's from a company called Moderna. They had a fairly close, almost the same, roughly the same efficacy, over 94% in severe infections. And for they also 2 doses, and for this vaccine, the efficacy is being assured after 14 days. And for the third one that was just approved last month by company Johnson & Johnson, they took a different approach. They didn't use the messenger RNA technology. They used some kind of a technology. They kind of had a virus that could cause common cold, but it's actually, they subdued the virus to not cause that. So regarding the third vaccine, Johnson & Johnson, but for them, they had results. They studied people who are with moderate to severe infections, and also people with severe infections. And they saw that their vaccine can have efficacy of 66%, and that's for the moderate to severe infections, and for the severe infections, they had a 85%. And again, in the world of vaccinology, that's considered highly successful, especially in the middle of a pandemic. So hopefully they can only get better, because the more people that get, the less chances of all seeing variations to this virus. So we just have hopefully focused on improving safety to improve side effects that people can get from this vaccines. And as regards side effects, most notably, like most injections, we just have a reaction maybe where you have the injection, and you're likely get a fever and muscle pain, and most people resolve within few days for the side effects. Excuse me. Let's see if I something else to add.
Well, thank you, Dr. Adeniran, for your input. I'm not sure exactly if you've completed your thoughts. I just wanted to interject a little bit. If you're still,
it's fine. It's fine.
Yeah,
Thank you.
If you're still, giving us some numbers, some figures, by all means, I would yield and have you continue, and then we can always come back later on should the audience, have questions that they need clarification on. So, are you?
I'll rather come in later if there are more people. Yeah.
Okay. All right. Oh. Okay. Well, thanks again. Thanks for your input right there. We also have briefly one of our presenters, also who is Dr. Adebola Adeniran, who's a registered nurse in the public health sector. You're currently, working in acute setting in the United States military. I believe you've been about 9 years. I was told. You can speak to us briefly about the expectations regarding the vaccine, the nursing management, and clinical, measures that we wouldn't otherwise, have an understanding of. If you please just let us know briefly, your perception.
Thank you, Honorable. We are glad to have you on this platform.
Thank you.
You are welcome. And thanks to the Church of God, Trump Tower Resource Center, for giving us this platform to use to educate our population about the importance of getting this COVID-19 vaccine. And I hope that we will be able to take one or two things out of this, presentations today. Especially those of us that are scared of getting this vaccine, maybe from getting one misconception or the other, So I hope today we clear some things out, and we're going to roll up that sleeve when it's time for us to get the vaccination. So when it comes to vaccination, there's something that we call herd immunity. So it's just saying that most of the community, maybe they are exposed to certain disease, virus, or maybe you are vaccinated. Just saying that the community is protected, from whatever disease we are talking about. So that is what herd immunity is. So it's very, very important for us to be, to be protected, to have this herd immunity. So with this COVID-19, you don't want to be exposed to it. From personal experience as a registered nurse, I've taken care of so many people that had COVID-19. I mean, severely sick. I've seen people, they are infected, they are okay this minute, the next hour, they are intubated. So that is not really the route we want to go. We all don't want to be infected, but we want to go to the route of being vaccinated to be immune to this disease. So after today, over 100 million has been vaccinated against COVID-19. Like 36 million are fully vaccinated. So I'm bringing this out because it's important to be fully vaccinated for you to be protected against COVID-19, which is the same thing with, every other disease out there that, you get vaccinated for. So you need 2 doses of this vaccine. The Moderna and the Pfizer, they are 2 doses, and the Janssen, that was just started probably about 2 weeks ago or less, that's 1 dose. So it's very important for you to complete the dose for you to be immune. So I'm going to be talking about, briefly, certain points so that we can be confident about getting this vaccine. You don't want any shock, when you get the vaccine. So I'll be briefing us about what you need to expect when you get the vaccine. So which will be highlighting the reactions, the side effects, maybe anaphylactic reaction that you can get from getting this vaccine. How you can manage the symptoms that you get when you get this vaccine. I'll be talking about my personal experience because I got the vaccine. My husband got it, and I'm glad, I probably, the first set of people when it first came out, I got it. I'm happy that I did. And it doesn't mean because you got the vaccine, you should stop doing everything. So I'll be pointing out what you need to do after vaccination and certain things that have changed also for people that have received this vaccination. So what are the things you need to expect when you receive COVID-19 vaccination? First, the reason you're getting it is you want to be protected against COVID-19. You will get the protection, but bear in mind, it's very important that you remember that the vaccine, like Dr. Adebayo has pointed out, it's not 100% efficient. It's with every medication that you take. you don't get that, you don't get a 100% efficacy from it. So it's the same thing with this COVID-19 vaccination. You know, the first two that they started, I believe, the Moderna and the Pfizer, they give us 95% immunity against severe illness. And the Janssen that they just started, it's 85%. So it's very important for you to, you know, to get the full benefit from this COVID-19 to complete your doses. So I'm saying that, I'm reiterating that because some people, when they get this vaccine and they have certain reaction, they don't want to go ahead and get the second dose. You have to remember, if you don't complete the second dose, you are not really, you know, protected against the disease. So that going, you know, bear that in mind when you are going to get your vaccine. There are certain things that will happen. It's not new. It's probably every vaccine that you get, you have certain reactions to them. You have some kind of reaction. Even if we as adults, we cannot remember the reactions we've had to, you know, medication vaccine in the past. Our children, when they get vaccinated, we know we always getting Tylenol, you know, on the side that, you know, I have to watch you overnight. So it's the same thing with this COVID-19. So the reaction that you can have to this vaccine, COVID-19 vaccine, CDC actually, they break it down into 3 categories. The first category is allergic reaction that includes anaphylaxis reaction. So this reaction really, they recommend it's because probably you are allergic to something from, you are allergic to something, one of the components of the vaccine. So your body will react to it, you know, in an unusual way. Just to have peace of mind, when you go to the vaccination center, wherever you are vaccinated, it is required that you are monitored 15 to 30 minutes, depending if you are somebody that's had allergic reaction in the past, anaphylaxis reaction, they will keep you long, at least for 30 minutes to monitor you. So medical personnel, they are always there to take care of you if anything happens. So this allergic reaction, what are the symptoms that you will feel? You know, you can feel, there's something we call in the medical field, feeling of impending doom. That is, you just feel like everything is going to collapse, you know, everything will just stop. You know, you have that feeling. You have flushing, your face probably red, itching, swelling, your throat is closing. Some people, they will be confused, come with dizziness. They might even, some people will lose consciousness. That, you know, we call that, you know, passing out. Some, they will have shortness of breath. They will be wheezing. Some, their oxygen level will be very low blood pressure, their heart rate will increase, you know, all those things. There are medical personnel standing by anywhere that you get COVID-19 vaccine, that they will monitor you. If any of those comes up, if it is determined that it is an anaphylaxis reaction, probably they're going to advise you not to get the second dose. And they might ask you to try something else, try the other vaccination instead of the one that you got that is giving you the symptoms. CDC actually recommended if you have anaphylaxis reaction to the vaccine, to any vaccine, don't get the second dose. So that being said, the second category of reaction you can have is what they call vasovagal reaction. So it's just your immune system responding and being too excited, you know, to receiving the vaccine. The CDC recommended you get the second dose. And always remember, there's always somebody there to watch you when you get this vaccine. What are the things that you feel? This vasovagal reaction, it usually comes like 15 minutes after you receive it. So that's why, remember, when you get that vaccine, you cannot leave. You have to be there so that you can be monitored, so that you will be safe. You might feel warm or cold, you sweaty, dizziness, you might be weak, very anxious, nausea, vomiting. You can go ahead and get your second dose of the vaccine. So the most common category of this reaction is the side effect. Probably most of us that we have received this vaccination, we have this side effect, what we call side effect. It could be local, it could be systemic. Usually you can see this, the side effect 1 to 3 days after you get vaccinated. What do you expect to see when it comes to the side effect? You can have fever, chills, fatigue, tiredness, pain, redness at the injection site. On the arm that you got the shot, you might have a swollen lymph node. You might have headaches, vomiting or diarrhea, body pain, muscle pain. The CDC advice, when you get all these are the most common, really, the side effects. Most people will get 1 or 2 out of these side effects. When you get these, please get your second dose. The side effect will go away. It's only for that, for some days. You can also have delayed reaction especially on the injection site too, maybe up to like 2 weeks. So if you see a bomb like 7 days after you got the shot, it's delayed reaction. It's something that happens. And remember, all these things, all this information that they are giving us, they are all in the researches they've done. They have seen it, people have been monitored. So that's why they're sharing all this information with us, that when you see all this, don't be scared. It's something that is expected. So please go ahead and get your second dose. And remember, I said you will be monitored when you get your vaccination. The discomfort of this vaccination, of getting COVID-19 vaccine, it's nothing compared with being out of breath when you get COVID-19. So we are highly encouraged to get the vaccine. And just to be part of the solution and not the problem, when you get the vaccine, there's something that they will give you, it's a database that is monitored by CDC. It's called VSafe. So they monitor your symptoms, like maybe for like the first 5 days you receive the vaccine, they monitor you every day. They want you to report your symptoms. Please do. It's just being part of the solutions so that we can get more information about this vaccine. So I will talk about how you can manage your post-COVID-19 vaccine symptoms. Regular other vaccines that you get, take Tylenol or ibuprofen if you are feeling feverish, if you have body aches, take Tylenol as long as it's not medically, as long as it's medically appropriate. You can take Tylenol. And it is advised that you don't take medication before you go and take your vaccine, just because you don't want the medication to mask the symptoms. That it's better for you to rather get the symptoms and manage it than taking medication before. At the injection site, wet, cool cloth you can apply on it. It's going to soothe, it's going to help with swelling and redness. Use that arm. Make sure the arm is not stagnant. Exercise the arm. Drink a lot of water. Make sure you hydrate yourself so you don't want to pass out. And we advise, please take time off from work. It doesn't hurt to take time off from work. The first dose, just the way vaccine works, when you get the first dose, you may not have these, many symptoms. You might just have like mild symptoms. When you get the second dose, your body is now realizing, oh, I recognize this thing from the past. So your body is going to react, be more aggressive when you get the second vaccine. So you might get, more symptoms, that is more actually severe symptoms after the second dose. So it's advisable that maybe if you work Monday to Friday, get your second dose on Friday so you can have 2 days to rest before you go back to work. I can testify to that. So that being said, I'm going to share my personal experience when I got the COVID-19 vaccine. The first dose that I got the Pfizer vaccine. The first dose, when I got it, the only symptoms I had was my arm was sore. That was it. Nothing, not a biggie. It went away like within 48 hours. When I received the second dose, I had worked the night before. So when I got home, you know, like by the maybe like 6-7 hours, I was feeling like unusually tired, more tired than I usually would be. So I was thinking, oh, it's because I worked last night. Maybe that's what. But the following day, when it's time to get up from the bed, I was like, no, this is not normal. This tiredness is coming from the COVID-19 vaccine that I got. So I realized that day I stayed like probably all day in bed. And that's it. By the third day, I was going about doing my things that, you know, it's all over. So I'm just advising that the second dose, we may see like more, you know, severe symptoms, side effects. So just be mindful of that. Take your time and take your time off from work. It doesn't hurt. 2-3 days. So I know you got this vaccine and you are thinking, oh, it's all done. I'm done. You know, I'm free from COVID-19. I don't have to do anything anymore. All the precautionary measures they've been, you know, putting out since last year. I don't have to bother about that. No, it is not. You have to really remember that we are our brother's keeper. Keep your brothers, you know, encourage others. It's enough, you know, even when you still continue with all those measures, you encourage other people besides you. So you still want to continue with all those precautions. Your social distancing, continue. Wear your mask, especially when you're in the public, put on your mask. Still avoid crowd. It's not getting the COVID-19 vaccine. It's not giving you the permission to go and, you know, be mingling with crowd, having parties with 1,000 people. You know how our community will love to, you know, we love good time. Still try and avoid poorly ventilated spaces, especially when a lot of people are in the area. Until more is known, because research is ongoing every day, you know, they are coming up with new advisories, new precautionary measures. So until we get all these things all together, you know, we should still keep going
Yeah.
about taking all those precautions.
Yeah.
So
On that note,
changed?
yeah. On that note, I hope just I'm being mindful, you know, of time. You're giving us very good information, and I believe people are taking note of it. And then towards the end, people, you know, I'm sure listening and watching, you know, audience, viewing audience rather, they will have some questions. And I think I have some questions, you know, but not right now. Now, in the interest of time, I'm going to have one of our speakers. I don't really, that's Dr. Sharon Temple. I'm going to ask Dr. Temple is an optometrist, a registered nurse, a gerontologist with a specialty area in risk management and quality assurance, infection control, you know, specialist. I happen to know that you've taken your, you know, vaccine, at least the first dose. Correct me if I'm wrong. And then just because we're trying to make this interactive, you can without. You can tell us some of your experience, but don't scare me because I haven't taken mine yet, but I will, you know, just tell us whatever the, you know, the reactions are and where you are. I hope you're feeling better, by the way. I think you're on mute. Okay, good. We can hear you now.
Can you hear me?
Good.
Yeah. I took the vaccine knowing that we're going to be having this discussion on Sunday morning. I just sneaked out and went and got the vaccine. And I was okay. I was fine and did my thing. And then early hours of Monday morning, um, the first thing that I started feeling was the coughing and the sneezing. And to me, I felt, well, maybe I work in a respiratory unit or vents. What happened? Maybe it's just something, I'm coming down with a cold. But by 7 o'clock in the morning, I had the sore throat. And it was so difficult to swallow, just to, then I couldn't breathe. And I actually had to call one of the respiratory therapists to give me a breathing treatment. I drove home. By Tuesday morning, I had aches and pains. And then when I went down to get food to eat, I could not taste the food. I had ringing in the ears. I had aches and pains. I had severe headache. But in all, my temp was just normal. By Wednesday, it was just down the slope. By that Tuesday night to Wednesday, it was full blown. Full blown in that I couldn't lay my head to sleep because now I was having constrictions in my throat. I could not lay down. And every single time I laid down, I felt like I was choking. I was dizzy. Couldn't do anything. Couldn't keep any food in. My face was swollen. Anybody that saw me between Tuesday evening and Thursday morning was like, what is wrong with you? I do know that I have large features, but it was 10 times that, with a big head. It was all swollen. And but one thing that really helped me was, somebody said to me, get the garlic, the ginger, the onion, the turmeric, and just keep drinking. And honey with Tylenol. So I was on 4 hours of Tylenol and continuously, even up to yesterday night and this morning, I have still been coughing and still having difficulties, a little bit weak, but not as weak as I was. So I think mine was to the extreme. It's easier to tell the story, but to experience it was the most difficult of it all. And I had to really position myself to sleep better because now I knew what we do with our patients in the hospital, positioning to open up the airway. Because every single time I laid down, I felt that my own airway was closing up. So these were some of my experiences. Am
Well,
I
thank
going to
you.
get the second dose? I don't
Yeah.
know. So that's why we're here today, because
Well,
of what I
this,
went through. But
I
what my
guess, I've
sister
heard
is
two
saying,
things. I've heard, if you started, you must complete it. However, if you're experiencing the kind
from
of
what she
symptoms
said,
that you're having, then, maybe you shouldn't get it. So I don't know where we go with that. But, thanks for your input. I have, our speaker, major speaker for today, and the person of Dr. Nelson Aluya, internal medicine practitioner, a pediatrician, a health advocate, a community leader, and certainly the president of the Nigerian American Public Affairs, committee. I wanted to have, Dr. Aluya here, who will be speaking about the importance, relating to what you've all, gathered, and most importantly, also about the impact on the community, not having it, and so he's going to round it all up for us. I purposely put him last, so that he can, educate us more about, the vaccine, itself. Dr. Nelson, I see you. I was struggling to identify if you were on, but I do see you never disappoint us. And thanks for all the work you do. I know you've done this, before in the community regarding COVID-19 and possibly, today as well, because I always see you online. So welcome. I'm glad you can join us, and you can bring this home to us,
Well,
please, Dr. Nelson.
Thank you, Dr. Follow, for the introduction. It's a pleasure to be here, and again to talk to my people about COVID-19 vaccine that's important. Um, I want to share a quick slide, if it's possible, but I'll just run through them quickly so that we would, I think you have to let me be able to share the slide. Is it possible? Because sometimes visual things are always um, important to get a big perspective of things. Dr. Fuller, is it possible you make it possible for me to share?
Uh,
Yes.
Yes,
Yeah,
sir.
I
You can
will
share your
take
slides
a
now,
technical
sir.
person. I believe they should be try it, and then let's see if it works. I'll let you know.
All right.
Okay.
So, going to put, okay. So a little introduction. Today is the 13th. COVID-19 vaccine, what you need to do. We'll just go quickly through them. I'm a professor, assistant professor of medicine at New Jersey Medical School at Rutgers University, also an attending physician at the Newark Bethesda Medical Center. So it's important for us to understand that technology is where we are, and technology is what's going to drive us to what we need to achieve in the near future. And I'm starting this, slide or this talk, making us understand, because we're not just standing here on our guides alone, but on the template on shoulders of those who've been here before us and those who will come after us. And we must inform our community, our immediate family, our community, and the entire Black race about what these um, technologies are and why it's important that COVID-19 vaccine is important, so that we continue to save ourselves, save our family, save our community, and save our Black race. Because if you look at the statistics today, while you have over 40% of Caucasians who've taken the vaccine, we're still lagging behind about 11 to 14% in the Black community, and that's out of distrust. So coming on to these things, 5 things you will have to look. If you haven't looked at it, please write that down and go look at it eventually. And learn to study this, because this will drive how you and I interact with one another and how we will interact with our environment. The first one is artificial intelligence. The second one is the 5G technology, which they've been talking about. And we heard when 5G came out and COVID came out, people were screaming and yeah, oh, 5G, oh, it's COVID, they're going to change your DNA, all that and all that. But you see, information is power. And if you're informed, you're better able to, inform other people, better make informed decisions, and better to take steps that will advance your cause. And that's your cause of your family, your generations coming and above. And the third one is blockchain technology. The fourth one is cryptocurrency that comes out of blockchain. And the fifth one is the mRNA technology, which is why we're here today, that has created this platform for original vaccines that we came to help save our lives. Now, why is it important? Often enough, people say coronavirus, coronavirus. A lot of people don't know coronaviruses have been with us from the beginning. As soon as humanity lived, coronavirus has lived with us. There are millions of other coronaviruses that we don't know, but some of the ones we already know now, from the flu, the influenza, the parainfluenza, the what do you call it, the adenovirus, just name them. Them human metapneumovirus and all that. Those naturally cause what they call a simple cold, and that's what it is. But then, within the last decade or more, we've had a few cases where we've had coronaviruses becoming a big issue. There are a whole lot of viruses, the coronaviruses, and we'll begin to learn more of them as we go on. But the ones that really begin to cause problem, the SARS one, which came out way back in 2005, the Middle Eastern Respiratory Syndrome with the MERS. Some of you heard of it, some people didn't hear because it didn't really come here. It caused the epidemic in those areas. The MERS was the Saudi Arabia area. The SARS was, of course, in the Indochina, and then which was the SARS-CoV-1, and then the SARS-CoV-2, which eventually came out of Wuhan, as we know, and then affected us even more. So, moving on, we heard the whole story. It came from bats, spread to human, whether it was a mistake from the lab or it wasn't. They're still, WHO is still working on that. They're trying to find out if the original people who worked in the lab were really sick from the disease. But yeah, they said some of them were sick, or some of them were sick, but then, we don't know if they're really sick from COVID or whatever. But moving on. So these are the few ones that cause the 229E and NP1 and all that and all that. But the real ones that are causing disease that are becoming epidemics and pandemic is the MERS, the COVID-1, and then the COVID-2. Now, this is exactly what it looks like. The COVID vaccine, the COVID virus itself. So this is the main character, and then you see the spikes, and then the receptor sites where it attaches to receptor sites. These are some of the things that will become of importance so that we understand what this means and why the vaccine came out from where it came out from. So globally, as I recently last week. Or 2 weeks ago. Now we have over 500 deaths in the United States, and all these numbers are increasing. And the number of cases in Nigeria has gone up, and deaths had moved up to about 2,000 cases so far. So signs and symptoms, they already talked about: the cold, the shortness of breath, everything that we talked about, the nausea, the vomiting. And not everybody presents in the same manner as somebody else. Some people will just be there and no signs or symptoms at all. They're asymptomatic. And then you have others who will come from generalized aches and pains, overt fatigue, which is notorious for COVID, the SARS-2, to respiratory distress and respiratory failure, and eventual, intubation and death. So when do symptoms begin to appear? Between 2 days to 14 days after exposure to the virus. If you think you're exposed, please seek help. It's been here for a year now, so I think we understand far more now what the signs and symptoms are as compared to what it was when it actually started, and we're really, struggling to find out, what the symptoms are, what does it mean, who gets what, and who gets not. So these are the various tests that you have. I think somebody had talked about a few of them earlier on: molecular test, the antigen test, and the antibody test. The significance of that, will go on if you have questions. The diagnosis, the laboratory tests as we go on, stages as it may be, and the epidemiologic surveillance, and some of the terms that you will hear. Risk factors, those who are more at risk for coronavirus. Can you guys see some of the thing that I'm seeing now? Or you just see the whole plain screen? No?
Actually, yeah, we can. I mean, we're listening to you, but I don't believe we see the slide. I was, if there is I beg your pardon?
You don't see the slide?
No,
Oh
the
my
way
God.
mine was cataloged in such a way. Is there anyone that's seeing the slides by raise of hand? You can just, let us know, but we are listening. Oh, now we can see your slide.
Oh, let me see.
Now we can see your slide.
Can you see it now?
Yes, very much so. We can see it now.
Okay.
And that's
I'm
important.
just talking.
No, well, I mean, we're following since we couldn't see the slide, but now we see it.
I just gotta go on quickly straight into the whole thing so that we'll see where it is. So COVID-19 disproportionately affected African Americans or people of color as compared to Caucasians, because again, the disparity in healthcare delivery and utilization. So those are some of the reasons, and these are some of the statistics that are out there. Now, this is the COVID virus. So the earlier slide that I showed has seen this, the virus itself, and then the spike. Now, the spike glycoprotein, the RNA, which we all hear about, the envelope and everything else. So we'll move on. And now the reason why this is important, because again, it tells you from where and how you can get vaccines made. You can get the whole virus and kill the virus. You kill the virus either by taking away the nucleus. Once you take it out, it's dead. And then you can infuse or inject the whole component of the virus into the human being. Or you infuse some chemicals into the virus with the nucleus and everything intact, and then inject it into the host or individual. But before you do that, you grow those viruses and then inject it. Now, what they did was with the MERS, they took a small component of the spike and using the PCR technology, which we've had for decades now, to elongate the protein. And on that protein, which is what they used to form the vaccine. It was so much quicker because the PCR technology was able to get the protein expanded. If you understand what PCR is, that's what the detectives use in identifying any human what do you call it, DNA when there's a crime, even if it's 10, 20 years, just a little speck of it, you can pick it up and expand it. And PCR means polymerase chain reaction. So moving on, these are the ways by which the COVID vaccine was developed. You can see the different one, like I said, what do you call it? The one we have now, which is the Moderna and the Pfizer, is here in the United States where they use this. The vector one, which is the adenovirus vector, they use the adenovirus because, again, was so adenovirus is ubiquitous it causes common cold. So they infuse the DNA, the RNA component into the adenovirus, and then use this as a vaccine, like they did in the Johnson and Johnson. So these are the other ones, like I said, the inactivated one, the subunit, the DNA viruses. These are ways upon which you can create vaccines. Now, the clinical vaccines, these are the trials that they did and the stages upon which you get vaccines. But you see, this was done, the COVID-19 vaccine was done within such a relatively short term. But they didn't, skip any stage. They just went through the usual stage. But again, like I said, technology made it possible for us to get this vaccine out quicker because the world could not afford to wait for millions of people to die, like the last pandemic we ever heard of that came out in the Spanish flu. In the Spanish flu, estimated 25 to 100 million people died globally. In this country, 2.5 million people died in the United States as of 1918. And you can imagine what technology has done from 1918 to today. So we're glad, we're grateful that we live on at this stage. But the beautiful thing is people are working on so many things and so many areas. And some of those things that may seem unrelated will now eventually become related to a particular thing what we're doing. Now, the COVID vaccine, especially with the mRNA technology, came about when you get to hear a name, Dr. Catalina Carrasco. If you look her up, she worked on the mRNA technology and she started doing this. She's a Hungarian, migrated to this country with her family just to do a PhD like everybody else, and worked on the mRNA because she thought we could use mRNA to treat diseases. From connective tissue diseases to diabetes to treating obesity. But then she was ridiculed. They made fun of her and said, "Oh, this is not possible. You can't walk, go away." And she was not made a faculty member because of that, or even a professor. At one time, she was actually demoted. But then guess what? Now, the stone that was cast away has now become, the pillar that built the house. So, and again, you hear the envelope, the polymer that was used upon which it was made stable so that you can infuse it into human beings. Now, that technology was actually first written about in 1972. I think that Dr. Livingston did that. And again, when he wrote that, they laughed at him like, it's not possible. You can attach high big molecules, and what do you expect big molecules to begin to dissolve into human beings is impossible. But then again, when all of these things put together, and God works in miraculous ways, the vaccine initially was very unstable. And when they injected in mice and all that, a lot of them died. They were on stable stuff and fever and all that. But then she met other guys in conferences and all that. Again, that's why networking and connecting with people is so important. And when she met, they put heads together and said, you know what? The factor that is in this mRNA what you've developed that's causing problem is the uridine component. Because if you look at the structural components of the DNA and the RNA, they're a little different. The uridine is one component that is really different. So what they did, they knocked out the uridine and made it stable enough. And then that's where they now start using it in mice and find out that it was doing well. And then this is where we are with the technology and the story. So moving on, these are the different, what do you call it? Vaccines that we have out there. Like I said, the vector vaccine, which is the Johnson and Johnson, that was just recently approved. You see the participants that were involved, 60,000, 50,000, 45. So they just didn't wake up and jump into this. They put their mind into it. There was a whole lot of work and everything else. The Sinovac, the Moderna, the Sputnik. Sputnik is the, what do you call it? The Russian one, and the Sinovac and the Novavax are the Chinese one. And then, of course, the British one and the Mexican one as well. So how effective? 90% and 95% respectively. And these are the things they do. I'm sure there will be other questions and we will talk about them. So signs and symptoms, we talked about headache, fatigue, and everything else. Other severe side effects, rarely respiratory issues. But again, conclusively, nobody has died from taking vaccine. I know there were some reports of 5 people who died, but guess what? Those who would have died tomorrow, 2 days later, and then took the vaccine today and then died, they're like, oh yes, the vaccine that killed it. Meanwhile, they probably died of heart attack. You know, the same thing here with the side effects. When some people talked about Bell's palsy. Bell's palsy is an incident where the nerve of the face that supplies the face gets weak. And you usually get that in stroke, but then you can get in some viral infections and everything else that we don't know. As a matter of fact, when I was, much early in the medical school, which is like over 3 decades ago now, we used to wonder like, what's the cause of Bell's palsy? We don't know. But then who knows? Maybe it's the coronavirus that was causing these or whatever. But then if you look at those studies, in the Moderna one, I think there were like 3 cases. No, in the Moderna, there were about 2 cases. In the Pfizer one, there were about 3 cases. If you look at that per 100, and that's the incident. But in this country, there are like 44 cases of Bell's palsy per 100,000 every year. So, I mean, 100,000 would, whether you like it or not, will come out of Bell's palsy. And you have 2 cases. So maybe they were actually going to get Bell's palsy anyways, but then they ascribe it to whatever, but no direct link to that as well. So these are the myths. Was it developed too fast? Well, it was developed fast because technology was able to do that. And I always tell people this: if technology can make it possible that each and every one of us here sitting in here right now, in our living rooms, wherever we are, we can see each other, talk to one another, and that technology has made it possible for you to drive your fancy car with your iPad and touch screen and then navigation. And technology has made it possible that you're not using your children as a remote control to go touch and then turn the dial or using them as antenna. What do we expect? Technology also would affect the way we produce vaccines. And that's what has happened right now. So we should learn to embrace it and accept it. mRNA change your DNA? No, it really doesn't. I know, this issue of fact of whether it changes your DNA can come from conspiracy theory when some people heard about the CRISPR-9. That's something else totally different. But then people love to mix things up and make it sound so, hyperbolic and blown out of proportion because they are anti-vaxxers, and irrespective of what you do, they're going to say no to vaccines anyway because either they're imam or bishop or whatever told them these things are not good, don't take it. mRNA vaccines have dangerous ingredients? No, they've been tested in all the people you see, and they've been found to be safe. But look, we have 7.3 billion people on Earth right now. Again, you eat an egg, you're fine. I eat an egg, I end up in the ICU. Does that mean eggs are dangerous? No, it just may be just dangerous for me, right? So that's not the answer. Now, is it safe until we get more long-term data? Some people have waited, even those who are in the medical field. They're like, oh, I'm going to wait. Maybe people will start growing horns in another year or whatever. But the question is this: we need to save lives and livelihood. We cannot wait and afford to what it is. You see everybody's wearing masks right now, how difficult and annoying that can be. And then if you want to travel, you can't. The risk of death is still out there. People are still getting sick on a daily basis. We can't afford to lose anybody. At one point in time, we have people who have lost friends or family. Why do we want to wait for that? So why would you want to wait? I've taken mine. I took the Moderna. Initially, I got a little aches and pain, a little fever. On that 24 hours, I did well, and I moved on. So I haven't grown any feathers on my toes yet or anything, and I don't think that will happen. So moving on, is it safe to take? Yes. What are take-home points today? Is it safe to take? Yes. Take your shot. Does it change your DNA? No. Please be informed about the viruses and the disease symptoms. Wear your mask to protect yourself, family, and the community. And of course, the social distancing that we talk about. Wash your hands. Avoid crowded areas and gathering. Do not travel unless it is absolutely necessary. I'm serious. Really don't. If it's really necessary, then you can. Because again, because you took the vaccine does not mean you can't spread it. But the beauty is it will save your life. You won't get really sick that much. But then if you get it and somebody else is not vaccinated, you can still spread it. Hopefully, it will be a denatured one and it will not kill people. Together, we will save lives and livelihood. And like I always say, the only thing that's permanent in life is change and the technology that drives that change. Thank you.
Uh, many thanks, Dr. Nelson Aluya. Thanks for your input as always, educating the public. I know what you do because we work in close, proximity. I'm glad you were here along with, other, guests, Dr. Adebayo Adeniran and Adebola Adeniran kind of sound similar, and then of course, Sharon, Temple. Thank you so much, doctors, and the general public. They're taking in this information, and I will just like I promised, we wanted to make this as interactive as possible. Therefore, I know people out there. It could be if you're watching us on Facebook and on other avenues as well. And if you just logged on and you joined with us on our Zoom, please feel free to type in your questions or just raise your hand, and we're going to make sure that the question is not more than 30 seconds if you have to speak. And then of course we will be monitoring with regards to any technical issues that we may experience. So if that's the case, I will encourage everyone to simply type out the questions, and any of our medical experts will be glad to provide an answer to you. Dr. Temple, is there any question currently that's showing that you would like to read to us?
The first question is for Adebola Adeniran, and the question is, if you actually outlined the side effects of the vaccine, and you're still encouraging people to take the vaccine, and immediately after the vaccine, they're being monitored for 20 to 30 minutes. What if when they leave and they go home and they have these anaphylactic reactions, what would they do, or what will happen?
So most of the time, when you have anaphylactic reaction to a medication, it's within a certain period, like 30 minutes, you should get the anaphylactic reaction. If you go home and you are not comfortable with the symptoms you have, please call your doctor, call 911 if you're uncomfortable, because you don't want to sit at home with any life-threatening symptoms, especially when it comes to respiratory. You want to seek immediate medical attention.
Thank you so much. The other question is, what is the side effect on pregnancy and people who wish to get pregnant? I think Dr. Aluya or Dr. Adeniran can answer that question.
Well,
what is the side effect on pregnancy or people who wish to get pregnant?
the question is it okay that pregnant women take the vaccine?
Yeah.
That's the question. Um, you know, like everybody else, pregnant women, pregnancy is not a disease. It's a condition. So if you take it, you will react like anybody else. Would you react in a more severe form? Most likely not. Hopefully not. Because again, pregnancy is really very protective of a lot of autoimmune diseases that are out there. Can pregnant women take it? Yes, you can. Was it really studied in pregnant women? No, not really. But then it's been advised that they take it. There's no contraindication to that. It's okay that they take it. If they have signs and symptoms, of course, they will take from the mild cases, take morphine or Tylenol, and drink a lot of fluids. And God forbid they have more severe cases and threatened abortion and all that, then yes, you can please call your doctor.
And the other question is, we have the three types of vaccines in the US here. We have the Pfizer, the Moderna, and the Johnson. Dr. Adebayo, which one do you suggest that people take?
Which of the three approved? Well, the federal government has given us three choices, so we don't have much say as to which one to get. So for now, I really cannot, go ahead and say one. I don't think we have, much control. But I did get the Moderna. I think most people so far got the Pfizer and Moderna. So most likely, depending on scheduling, you're gonna get either one of those.
And another question somebody else is asking, can you get COVID even if you have only taken your first dose of vaccine?
Now, Dr. Louis,
Well,
anybody,
um,
anybody, yes.
if you understand what these vaccines and the coverage rate is like, um, just like the flu vaccine, you take the flu vaccine, and the flu vaccine usually, if you keep an eye on it, it covers you. Sometimes it depends on the year because flu has been around with us for over a century. You can get 25% to 40 to 50 or 60% maximum, but these ones have been able to cover up for 90 to 95. But for those who would take the very first shot, it gives you 57% coverage. So the remaining, 37 or 33%, you're not covered. So is it possible that you will get sick? Yes, most likely. But because your immune system have been primed already, even with the first shot, it's still better to get one at least than not get anything at all. So you see, the immune system is so beautiful and so complex the way God created it. It remembers, and there are things called memory T cells, and those are the ones that remember what happened. Even the immunity that your mother gave to you while you were still in her belly, you remember all of those. So those things are there, so that even if you were primed before, but one thing or the other, it will still help protect you. Yes, but you still can get it, but you won't get,
Thank you
morbid
so
disease.
much. I have a question from someone from London. We have people that logged in from England. And the question is, can this affect fertility? And they want the doctor to answer the question, can getting the vaccine, any of the vaccine affect fertility?
Well, no, the vaccines cannot affect. It doesn't affect your fertility. But if you remember some of the stories that came out when the whole hula hula of the uh, um, COVID-19 came out, it's a virus. Viruses choose wherever they go. It can go to the brain, to the lungs, to the tongue, everywhere. And you can see even the taste um, and smell you have a problem with. And then we heard, oh, it's in the semen. So it's in the scrotum. So obviously, if it's in the scrotum, in the semen, it's there. Now, only God knows what it's doing there and how much damage or anybody can react, if it's there. We're still learning this thing and we're going to learn even more. And we're going to gather this data as we go on to find out if 5 years from now, a lot of people who got COVID, and it's been said to actually remain in the semen for up to 3 months as at that time. So we don't know if the infection itself can affect that, ability to produce semen. So how much better would it be if you can take a vaccine that will help prevent that, so that we can prevent the unknown right now? And that's why it's so important you get the vaccine. But does it affect the fertility? No, it doesn't. It actually will most likely help you by deduction.
So
Yeah, I
what
know.
happens if someone doesn't get the second dose? Like, I got the first dose and I reacted. So what happens if I don't get the second dose? Anyone can answer
You'll
the
just be 57% covered and you're still at risk. But I'll tell you this, I got sick. Like I said, I got the COVID itself, so I know what COVID virus can do. And I'll tell you this, I had patients because we're taking care of patients and all that and all that. We did the whole thing, the whole shebang. And a few of my patients said, Doc, listen, the weakness that comes from this thing is unbelievable. And somebody had actually called it the sleep that comes. It's called the sleep of death. The
Yeah.
sleep of death is because you just want to sleep.
Yep.
You know, I mean, people get sick. When they get sick, they are comfortable, they can't sleep, but COVID makes you sleep. And that's the sleep of death that comes out of it. And until I got it, I didn't understand what that meant. I could sleep at that time for 18 hours in a day, but again, I went through it. I got I checked myself, I got antibodies and all that and all that. But then when I got the vaccine, I understood then that people who got COVID-19 often get a bigger reaction from uh, um, what do you call it, from the vaccine. So I was kind of expecting that. My wife did, she got the same thing. She got sick for a day or two. I got the fever, the aches and pain. But then I just did the typical thing, rubbed myself down with Vicks, took my hot water, took ibuprofen, ate well, slept. It was a Friday night. By Saturday morning, I was up again, running around and doing my usual thing. Now, the second dose, I was expecting a much bigger reaction. But nope, I got the second dose and I was fine. But I could tell that most likely I'll be fine because my wife, who got sick from the first one, sicker than I did, she got the second one and she was not sick. I'm like, oh, okay, there's hope. So I got my second one, I didn't get sick. And so a lot of people who've done that the same as well. So it's okay. You can take your second one. Don't be afraid.
There's a question for Debola Adenira. The question is, you were one of the first people that got the vaccine, and why did you make that decision to get the vaccine, having taking care of patients at the hospital? Why did you do that? And why did your husband at the same time get the vaccine with you? I know it's personal questions, but it's coming up.
First of all, when you take care of COVID-19 patients, like I said before, and you watch people, they come into the hospital like, oh, I'm tired, I'm weak. You have them, you're taking care of them for 12 hours. And by the time you go back the following night, they are not there anymore. They are dead. Or you start your shift with somebody, they are okay. And within a few hours, they are intubated on ventilator, and you don't even know if they are going to make it or not, So when you look at those people, you think, I'd rather get the vaccine than be in this position. I mean, that's me. And also, we have to be our brother's keeper. We have to take care of the community. And how do we do that? You cannot be, we have to think of them. So try not to be selfish, thinking about the community at large. So you want to be part of the solution. I want to be part of the solution. I'm not even only taking the vaccination. From this coming week, I start working at the Burlington County mega vaccination site. I want to be giving that vaccination. I just want to be part of the solution.
Thank you.
All right, so will we have any more questions, coming on? I have to say that I have a very strong panel here, dealing with this, especially, Adebola Adeniro, who wants to be part of the solution. We don't readily get people that wants to, volunteer, right away, but this is your chosen field, and we appreciate, what you do. We appreciate all of our medical, professionals. For people viewing, our viewing public out there, we are live, on Facebook. This is an RCCG event, Strong Towers, I believe. Thanks for putting the event together. We're so on. I have to say that my guests, today are Dr. Adebayo Adeniro, Debola Adeniro, Sharon Temple, Dr. Sharon Temple, and then Dr. Nelson, Aluya. They are here to take your questions regarding the vaccine to COVID-19. So, feel free, join us, chime in. It's an interactive, session we're having. We will continue. And let me see if any other questions here. Let me see here. All right. Perhaps any of my panelists want to continue, to chime in, something that you haven't already covered that you wanted the viewing public, to know. This is an information session, very critical for to our survival. We're talking about COVID-19 that's claimed so many lives. 30 million people infected here in the United States, more than 532,000 deaths within a year. We have 4.5 million people in the UK that are infected with about 125 deaths. And then we go slowly to a country, Nigeria, with 160,000 infection that's confirmed. And then so far, they have 2,000, death. And so we're continuing in this presentation here. Dr. Let me see, Adebola. Adebola Adeniro, you see when your patients, come in, have you seen like a return of, people, coming back in just because they're reacting adversely to this COVID-19 or the vaccine rather? Have you seen such?
I don't have any personal experience with people, that have been vaccinated and coming back. Because really I've not been working at the vaccination center, which I'm just going to start. But the day that I got my vaccine, I saw somebody there that, had, an adverse reaction. And what I could say is the medical personnel that were standing by there, they have doctors, paramedics, they were there, they took care of the person. If the person needs to go to the hospital right away to be further monitored, that person is taken right away. So there's that peace of mind that comes with, if anything happens, I have somebody, I have people that will take care of me.
Some of the reasons we do what we do here in this kind of presentation is to, educate, folks, out there, people that may, be having, hesitating to wanting to take the vaccine for one reason or another, especially in the minority communities. Some may claim they have, valid reasons to be, hesitant, a little bit, and rightfully so. However, we do have, our medical folks, that can, educate you more, on why it's important to take the vaccine. Currently, Dr. Aluya, at your, you've done a lot of these, presentations, and hopefully you've been able to change a lot of minds about whether or not they should take this vaccine. What are you hearing, out there from our community, the minority communities primarily, about wanting or not wanting to take this vaccine?
Well, often enough, I'll take it in two perspectives. One, for those in the diaspora, those who were born outside this country and migrated to this country. And I'll tell you this, a lot of, even those in the UK, a lot of them never heard about Tuskegee before in their life until they moved here. And a lot of them never heard about Tuskegee until COVID-19 came up. And they probably would not have if COVID didn't come up. A lot of people don't care, don't bother about the history of this country, or a lot of the things that really bother when it comes to healthcare disparity. We just come here, we run around, pursue our money, pursue our degree, be centered around our family alone, and don't even bother what's happening in the larger community. But again, do I say thank God for COVID or thank God for things? But I always say this: out of every good thing comes bad outcomes, and out of every bad outcomes come good things. There've been great things that come out of COVID-19. It's brought people closer. People have come to understand themselves better, understand their family and everything else, and even learn to embrace technology and see technology for what it is, and then have the time to retrospectively and objectively review things that is important to them. Now, when they tell me, "Oh, I have apathy towards not taking the vaccine," I'm like, "Dude, what do you know about it? Why don't you want to take it?" I mean, look back home. The common cause of death in age 5 or less is still preventable disease that preventable or prevented with vaccines. Nigeria, if we take it, for the last decade was in and out of records for polio, right? Thank God, I think 2016 or 18, it finally came off. It went off in 2016, came back in 2018, and finally off the list out of 3 countries that we still had polio in the world: Afghanistan, Pakistan, and then it was Nigeria. But again, and I ask those who live in the diaspora, when was the last time you saw somebody with polio? When was the last time you saw somebody with measles or chickenpox? You don't, because vaccines work. They vaccinated the children here and it works. But back home, we still see all of those things because either we don't have the capacity. If we do, I'm sure we'll be able to do that. So people are saying, "Oh, the apathy and all that." We don't understand or know the story of the African American experience. But we must begin to look into that and see why a lot of people are doing that. Not because people are saying that and we accept as well. But that's one aspect. The other aspect is, oh, there are people who are non-vaxxers. Irrespective of what you do, they're not going to take this vaccine. They won't. Even if their family is dying. I remember when the H1N1 came, and H1N1 was killing kids, a lot of them. I saw mothers who refused to give the vaccine for H1N1 that was infused or added to the flu vaccine that season. And 1 or 2 people, vaccines, families who I know, but thank God they're not of the Nigerian extract, had children die because they did not vaccinate their children. So there are people who will not, and they will always look for means to validate their points and say, "Oh, don't take it because it will change your DNA," because, and they just rootly, individually in their DNA, just don't want to do it. Now, coming to the African American experience, yes, there are reasons. 40 years, we hear the Tuskegee event and all that, but then that's over what, 40 decades ago now when it stopped. And as at that time when it started, how many of us were doctors in this country? How many of us were involved in research and everything else in this country? And how many of us were actually advocates in the healthcare space in this country? But things are different now. And we are paying attention to what's going on. We're involved in research. We have people who are sitting down in policies and politics space. Thank God we had a president who was black. We have a vice president now who is black. So we have senators and all that. So those are policies that are here. Like I did explain earlier on, they just didn't wake up to bring this vaccine and they want to shoot it up to people. And people think, "Oh, what's his name? Bill Gates have a hand in it." All those people, no, those are all lies. And I'm sorry. They have the agenda. We need to sit down and review those things properly so that we understand how best to protect ourselves. So in conclusion, we are in this space. As I described myself, I'm a medical advocate, and I'll tell you what I did in September. And I'm sure, Dr. Afolo, if you remember, we put together a community of people who were at university. There's a Nigerian who worked in the Madara study at Rutgers University at New Jersey Medical School. The CEO was involved with the clergy here. We pulled everybody together, and as the president of the New Jersey Medical Association, then I called um, uh, your organization. This is the African group. I called the Nigerian. I was the president or the chair of the AMPA, which is the Association of Nigerian Physicians in the US, in the Americas. I called the Ghanaian, the Caribbean, and everybody else. It was on Thursday night. I said, look, let's sit down. Let's find out what these people are doing. Because I knew then that this vaccine will come out and they'll start shooting out in our people. So let's find out, where did they get the vaccine from? Who's in the research? Where did they get the, what do you call it, the people in the study? How many of our people were in this study? I did that because it was important. Again, most of the medication that we all take, let's call a spade a spade. Most of the medication that you all take, from antibiotics or whatever, how many of us were in those studies? If you take a percentage, look, a lot of the time we're less than 1%. 1% in all those studies. And we gladly sit down and swallow those medicines without even know where they come from, sometimes from China or from India, and we don't even know what they contain. But we swallow it. And then this is here, something that's going to save our lives. And we're jumping around saying, no, it changed your DNA. No, let's be real. We're here, we'll keep paying attention to this. And if anything that's going to come out of it, if I begin to grow wings or feathers in my foot, I will stand up the first to say, listen, this is bad. But
please, please, the moment that happens, let me know before I take my own shot. It's coincidentally, I mean, you mentioned some of the health fair and events that we've conducted over a period of time since this COVID thing started, and I seem to recall also that the one you just referenced actually took place at the RCCG location in New Jersey. In Orange, and it was a very successful event, and we had a lot of people that came out. I was there representing the African Commission. I was also a member, of course, a member of the Nigerian Diaspora Organization, and you just, we pulled everybody, together, and it was very, a very productive, event, and I'm, encouraging people to continue to do that, educate people about how critical it is for us to have this vaccine. And I know, having said that, I would, I think I'll take mine. I was hesitating, and I wanted to see, how effective, this will be, or which one am I going to react, the kind of concerns that a lot of people have. But, it's working. For a lot of people, I wouldn't be an exception. I will go out there and do what I need to do. We're encouraging people to take advantage of this, especially in the minority communities where a lot of people succumb to the effect of COVID-19. And then that brings me back real quickly, and we have limited time, to the countries, let's say countries in Africa, in the Caribbean, that they don't have enough resource to secure this vaccine. I don't know if anything that some of these companies are doing to allow people poorer countries to benefit from this vaccine. Is there anybody you heard anything that's going on that people need to know? Is it going to be free to the poor people, or are they going to have to die from this vaccine? Hopefully that's not the case.
Well, there's what they call the COVAX, program. And I remember talking about it in a couple of programs that we had done. The COVAX is a United Nations or WHO program where they put together different countries. As at that time, there were like 196 countries. A few countries were poor and they could not afford to buy, because listen, look at Guinea or Ivory Coast standing in front of Pfizer to go buy vaccine, where United States or Germany is standing to buy. I mean, what's the capacity or what's the ability for them to do that? So they were smart enough to put this program together. As at that time, there was a whole politics. China was not in. And of course, the US under Trump was not in that program. And then China joined in eventually. And that's the reason why, if you look around, Nigeria got its own supply. Ghana was the first country in Africa to get its own supply. Brazil's getting. So all of that is under the COVAX program, where they made it cheap enough where those countries can buy, at least to save lives. So hopefully it will continue. They will continue to make it cheap. But then again, human nature comes in. There's politics, and you heard the Dr. General of the WHO came out screaming and yelling the other day, like, "Hey, these rich countries are harboring vaccines and they're usurping it. So please, be mindful, because if any country on earth is not safe from COVID-19, we're all not safe from COVID-19. So they needed to do that. So the COVAX program is still on, and it's doing as much as it can.
Okay. Well, thank you very much. I understand that we have more questions from the audience. I'll ask Dr. Temple to please, just read that to us.
What is the advice that can be given to we Nigerians where there seems to be this general apathy towards the taking of the vaccine, particularly with the issue of corruption and the fact that only about 4 million vaccines are available for a population over 200 million? So I think Dr. Aluye kind of answered the questions, but really, what can we do? What can we say to our people when they have limited vaccines in where there's a population of more than 200 million people?
That's a big example. We're talking about 4 million vaccine for who? For a city, for God's sake, with a population of over 200 million. So those are the kinds of issues that's, that's out there now that's maybe not being adequately, addressed. I encourage, any of you, if you want to, speak to that again. I know, Dr. Aluye, you kind of alluded to that.
Right. So,
Dr. Adeniran, is there any take on this?
All right. So regarding the shortfall with the population, I understand that. Oh, okay. Never mind. I thought I was off. Yeah. Regarding the shortfall, so like Dr. Aluye talk about the COVAX program. I believe Novavax is one of the vaccines that will be going to Africa. Hopefully, but I really cannot comment as the vaccines reaching enough of the population over there. I understand some of the fear being expressed. But it's partly on the government of Nigeria to really get the job done. They also could help by preparing, we know we're in the midst of a pandemic for the future also. Like been alluded earlier to, we take medications, we take things that we didn't really participate in the clinical trials for, and we just hope for the best that it works for us. But it's not. I don't think it's beyond what we can only help advise, but the government really is in the best position to implement. I don't know if anybody has another take on this.
I'll take this. You see, without going unduly political, again, listen, we have brilliant minds within and outside of Africa. And both those of us who are outside and those who are in have a stake in the country, I hope. And COVID-19 has been a year. Like I said, we knew the vaccines were going to come. So we expect that the government and the people of Nigeria should be getting ready for this. And they should be preparing themselves for this. Rather than spending money and buying, cars for those in legislative offices, spending millions of dollars to buy cars. Look, they should have pulled money together, getting this thing ready, so that they can begin to adequately prepare to cater for a population of over 200 million people. That's what it is. And that's what they should. And not buying the same amount of vaccines that Ghana is buying or Ivory Coast is buying. Are you kidding me? It shows lack of preparedness and lack of leadership. I'm sorry, but that's exactly what it is. Let's call a spade a spade. That again, we as people consistently lack the capacity to show leadership when it comes. I mean, it's a disgrace all around. I mean, a big country like Nigeria and all the intellect and brilliant people we have all over, and this is where we are with this. Are you kidding me? But, we understand that the government does not have the capacity alone to do this. That's where rich men in the country should sit and organize and say, you know what? Okay, what do we do? It's not just buying rice and beans or whatever and distributing to the population when COVID is going to come and kill people, because you want to feed them now, only when the election time comes and you want to vote them. But this is the time to save those lives that you want to vote for you when the time comes. So they should come together, put their resources together and say, you know what, from Dangote and Otetola and whatever, and say, you know what, the government, you can buy 2 million or 4 million. Let's put money together and see what we can help you guys buy at this time. The AstraZeneca, the Sinovacs, and the other ones are the ones they can, because we don't have, again, the cold chain, to keep the Pfizer and the Moderna. But you find out that a few of the rich people, of course, would either fly outside the country and go get it somewhere, which is a disgrace, or find a way to get it for themselves and to protect themselves and leave the others to I mean, look, it is what it is. But then, those people need to begin to come together to do that. Now, for those of you who are in the diaspora, and those of us who are in the diaspora, it is time we also begin to sit down and organize. And organize, say, listen, what can we do for our country? We see what's going on. I know we have apathy towards that country, a lot of us now, with the issue of not in my country anymore. I don't come over there anyway. Let me find out my pidgin English, but then that's for who we are. What it concern me, I don't come over Nigeria. But again, if they are not safe, remember, you're not safe here either. So it's time for us to organizations here, from NIDO to NAPAC to AMPA, we begin to sit down and say, look, let's have a discussion. What do we do? How can we help with vaccines in our country?
Thank you, Dr. Anthony. A quick, because I have a question coming from Nigeria. We have someone joining from Nigeria. And the question is, how do we know the quality of the vaccine they're sending to Africa is the same as the one that we use here?
Well, we have.
That's a legitimate question. And and I'm trying not to politicize this session, but you cannot take politics, out of this whole thing. That's a very legitimate question. And I was going to speak to the fact that, you might have, some kind of, fake drugs, going in there, pretending it to be the actual vaccine. But I'll let the medical professionals, talk about that. Can anyone answer that?
I mean, before we go into that, the last section of the question that the person had asked earlier on, what should they do? Since there's no vaccine, protect yourselves. Eat healthy, take your vitamins, exercise. If you have diabetes or high blood pressure, take your medications, wear your mask, and practice social distancing. That's what you need to do. I'll say this: car will not get in. I got the drive we fly. We all understand that. Look, I'm typical Nigerian, and I'll say it. We need to understand that. But outside of that, coming to the vaccine, to understanding what if it's the right thing to do. We have people. We have NAFDAC. We have COVID vaccine, task force. We have people who are out there. So it is their duty to ensure that this is happening. In all sincerity, we've had bust. There's a big bust, I think, in Germany, where some people and some people were trying to organize fake vaccine and distribute them. They were busted. Now, our people need to pay attention to that, and those who are on the ground whose duty it is to do that. And that's where all law enforcement agency and all the medical forum agencies, you have the Nigerian Medical Association, and the Pharmaceutical Association, this is the time for all of them to come together and say, you know what can we do to help you do this? And then the Nigerian citizens, if you're at the border, right, or you're a custom officer and they bring in fake vaccine to the country and you allow it in because you want to take bribe, then shame on you. Shame on you. Because that vaccine will come and it not just kill your neighbor, it most likely kill you as well. So it's the task of everybody to do this. And then, of course, those of us in the diaspora will keep our ears out. If we hear somebody is taking fake vaccine to Nigeria, then we call it out. We ring the bell, right? And start calling the authorities. We all boast of how connections we are connected we are in the government each time. This is the time to use your connection. Yeah, I think that's what I'll say. Thank you.
And I think I'm going to kind of refer this back to the African commissions. We have Honorable Anthony here. Based on the questions that are asking, I think it's time that we in diaspora will come together and begin to look into these vaccines and how we can help the government back home or help the people back home in making sure that they're actually getting the information that they need. Most people don't even have the awareness or know as much as we know here about this vaccine. So if we can set up something, have some kind of conversations, forum, I will really like to put that back on you because that's your office. The last question is, how safe is the COVID-19 vaccines on patients with terminal diseases like HIV, AIDS, and sickle cell? Can they get the vaccine?
Well, again, I've been on a number of forums. I just came off one to join this where 11 Black doctors come together every second um, uh, Saturday of the month, trying to talk to our community about this. Um, if you see, I think I did try to put it on a slide. I'm sorry, you guys didn't get to see it from the beginning. Um, those at risk, um, pre-morbid condition or underlying condition, diabetes, heart disease, if you're on dialysis, if you're obese, morbidly obese, 30% chance of dying from the disease. For those who have sickle cell, all of those things, yes, you take priority. Actually, you get you get a first dip. And of course, again, if you're 65 years and above, the reason being that is as we grow older, our immune system is not as strong as everything else. I mean, your arthritis sets in, everything sets in, memory begins to dwindle. So also your immune system. So that's the reason why they put that age and above for you to take it. So yes, if you have diabetes, if you have any of those, if you're a cancer patient, or if you have sickle cell, yes, you should get first dip and take it.
I think the last question is one of our youth, someone from one of the universities is asking, at what age should you get the vaccine? I believe the person is under the age of 20. So they're asking that question, at what age should you get the vaccine?
All right. If they're at least 16 or not underage, I believe they have choices. But if they have any reason why they are reluctant, they should speak to their doctor really. But they have choices. They're less than 20, 18 years above 18. I think they're fine.
Thank you.
Mhm.
Yeah, I think the Pfizer, you can go down to
Yeah.
18. The Moderna is 18 and above with the Johnson and Johnson. But there's studies that are ongoing to see if they can extend that study down to age 12 and even age 9, so that at those ages you can begin to take the vaccines as well. In the United States, 1.2 million kids had, suffered from COVID. We've heard about the multi-system inflammatory reaction that happens in children, and a few who have died. But those who died also have, very severe underlying disease as well. So kids, you don't, experiment on them like that. So that's why the ethical reasons and stuff like that. So, but hopefully down the road, we'll begin to get those reports as they carry out this research and we understand more.
I think the final one, I have a question. Anybody can answer that question. What is the significance of this lemon, garlic, onion tea? It's all over the place. You have to, it's the ginger, the garlic, the onion, the lemon. Everybody seemed to, turmeric, everybody seemed to have it as the cure for COVID. Can someone just talk about that as we wrap up? It did help me though, but I just want us to talk about it.
Oh, well, I don't know if anybody else wants to say anything. But one thing that's profound is that one, your initial immune status will determine how well you react to COVID-19. That's basic. And that's why you find that some people have COVID, no symptoms. And some people have COVID, they just have diarrhea, runny nose, and stuff like that. And those very severe signs and symptoms. So, but these garlic and COVID, turmeric and all that, they work in different forms. A lot of them are anti-inflammatory. A lot of them are anti-oxidants. If you understand how COVID causes disease, it's not the virus itself that causes the real damage. It triggers immune response in the individual, and that's why you hear the complement surge that we heard about. And that triggers a cascade of events where people get strokes, get heart attacks, and all the blockages within the lungs and everything else, and even amputations. Some people had amputations because of the blood clots that occur. So the turmeric, the garlic, and all that act as anti-metabolites, blocking some of those mediators that come out. And also they act as anti-inflammatory as well. Now we've heard about zinc. Zinc in the first COVID-1, that's the SARS-1, has been shown to actually inhibit the replication of the virus as it gets into the cell. And then you hear the big issue, one of the reasons why COVID has not been so devastating in Africa, because again, one of them, other than the fact that we have very young population, is that vitamin D has been shown to be of help, where it dampens that upsurge in the complement system, has been shown to enhance your innate immunity. So all of those things, that's how they all work. So yes, you can take them, but be careful as well, so that you don't overdose as well.
Well, for there, on Facebook or that's logged on to Zoom conference. It's been great information, session. I have to this medication, the vaccine, to the people.
Dr. Fuller, I think your reception is really bad now. We can barely hear you.
I think we lost him. He's going to try to log in.
Right.
He is attempting to log in at this time. He's asking if we can see him. Well, I think, honestly, thank you so much to the panel. Dr. Aluya, you did a wonderful job. We appreciate you. We thank you. Dr. Deniran, we thank you. And Debola, we thank you as well. And we also want to thank Dr. Bolaji, who also is, he's a PhD student of engineering at Rowan University. Can we see your face, Bolaji, somewhere there? You know, you've been gracious enough. Thank you so much. Gracious enough to kind of spearhead this and helping us with the flyer and also helping with the media. So we do appreciate you. And to everyone that really logged in, let's continue to have these conversations in our communities. We need to have these honest conversations because when we do, we become more aware of what we need to do and not just follow what people are saying. More especially, we would like to thank Strong Tower Resource Center, our pastor, who has graciously allowed us to use this forum for this discussion, and also Strong Tower Social Services for allowing this panel of discussion. And we're not going to stop at this. We will be having more and bringing in more people so that we can discuss things that affect us in our communities. So thank you so much. All that logged in, you have questions, please do not feel free to contact any one of us, and we will forward your questions to the right panel, the right persons, and they will be able to answer your questions. And at this time, I know Dr. Fowler is still trying to log in. People that logged in from Nigeria, thank you so much. I know one of our sisters have been working to try to get people to log in. Sister Blessing, we appreciate you. Thank you. People that logged in from London, hi, can we see your faces? If not, thank you so much. And people that logged in from here, the USA, thanks. All over the place. We appreciate you. Thank you. Dr. Fowler is here, so he can continue from here before we do the final prayers. Can you hear us now, Honorable Fowler? Can you hear us?
Yes, I can hear you. Can you hear me?
Yes.
Looks like I went off a minute.
Yeah. So we're wrapping
Oh,
up.
okay.
We're just gonna do the final prayers. If you have anything to say.
I think you know this is the best time to wrap up now that the network is acting up. But I want to thank all of the guests that joined us. First, you, Dr. Sharon Temple, Dr. Adebola Adeniro, and Dr. Adebayo Adeniro, and of course, our presenter also, Dr. Nelson, Aluya. It's been a great information session. Thanks to the RCCG. That's organized this along with the social service agency that's attached. Can you, I know our media person, Sharon, there's somebody that's in charge. Dr. I don't have his name here, but I know he's done a fabulous, okay. Well, thank you for saying he's done a fabulous job keeping us in line here and making sure everything works effectively. We should have, like I was saying earlier, have more of these, sessions for our community and beyond, and encouraging, the governments, wherever they're listening or watching, to please, help the people that are in need, that needs this medication, this vaccine. They should not have to succumb to their inability to afford, this medication, this vaccine, and where it's necessary, it should be free. To all of the companies, you don't have to strong arm, less privileged, countries that are unable to afford, the vaccine. You've heard, stories. We don't know how true that is, but about some countries that that would have to basically mortgage, their facility in order to secure doses of this vaccine. I'm hoping that is not true, but we will end this evening. My name is Anthony Afalo. Thanks again to everyone. There will be a prayer to round this up. After all, it's an RCCG event, and I will yield to the prayers.
I think we have to invite our pastor, Dr. Oloedi to the forum.
Thank you.
Can we spotlight him or his wife?
Thank you. Thank you very much. This is a very, very wonderful, informative, and educative. I really thank all our two doctors, Dr. Nelson and Dr. Anthony, Honorable Anthony. We really appreciate your effort. I pray that the Almighty God will reward your labor of love. And for the organizer of the program, I say kudos. Keep up the good job. I think that this is just the beginning of being a blessing to your generation. You know, church is not only meeting in an auditorium now. We can do a lot of things to empower the community. And I think that this is a very good steps. And I know at the end, God will reward us. Let us pray. Our Father and our God, we thank you. What a faithful God you are. We thank you, Lord, for this program and all your children that have allowed themselves to be used and the talent that they have used to educate us. Father, thank you in Jesus' name. We commit all of us to your hands, Lord Father. We pray for your divine protection. We pray for your divine provision. As we do our daily activities, you will continue to guide us, protect us, be with us. Thank you, Lord Daddy, for answer prayer. When next we do another program, we pray that it will be successful and your name will be glorified. Thank you, Lord Daddy, for answer prayer. In Jesus' mighty name we have prayed. Finally, I will advise, please take the vaccine. Don't be afraid. Fear can make you to be sick. Before I have mentioned it before, in my professional body, the American Counseling Association, research confirmed that many people died because of fear. Please don't be afraid. Go there with confidence, with faith. God is with you and you will come out successfully. God bless you. Be safe. Bye.
Thank you.
Thank you. Thank you.
Take care,
Thank you
everyone.
so much. So
So
this concludes this session this evening. Thank you. God bless.
Can the panel just stay a little bit, just for a minute or two?